I have heard everything from using vinegar and garlic for yeast infections. Like I've heard that growing up. I know Dr. Felix's eyes are opening super wide.
Of course, I'm a sexual health advocate, so I see all kinds of things that are coming through that you can buy on TikTok. Like there are these things called pussy pop pills, right? So I'm like, what is in that? As it turns out, it's really like a turmeric concentrate in these oils that, you know, supposedly have anti-inflammatory properties. But it kind of goes back to like what we're seeing on TikTok and what we're seeing on social media are more adaptations to maybe some ancient herbal culture.
This is Birds.Bees.Bodies, the podcast where we strip away the myths and get real about sexual and reproductive health. No shame, no stigma, just truth, guidance, and conversations that matter. Powered by Planned Parenthood of Florida, we're here to break barriers, challenge the silence, and give you the knowledge to take charge of your health and your future. Let's go. Welcome back to Birds.Bees.Bodies, Season 4, another season in the books brought to you by Planned Parenthood of Florida. We are so excited for the first episode of Season 4, Herbs, Myths, Medicine, Healing, or Hearsay. As always, I am your host, Michelle Quesada, VP of Communications for Planned Parenthood of Florida. And I have two incredible guests with me here today. Summer, our education program community educator, and we also have Dr. Felix, one of our staff physicians for the organization. Thank you both for being a part of this podcast. I did want to start off quickly talking about today's topic and offering a disclaimer. So we know that throughout history, people have turned to plants, home remedies to support reproductive health, from easing menstrual discomfort to encouraging labor or even lactation. But there's, where there's a line of where tradition ends and where potential risk begins. And we'll be talking about some of that. I do want to share a disclaimer that there will be some sensitive topics that we'll be talking about, including miscarriage, abortion. We'll be talking about different herbs. We'll be talking about the risks of poisoning and other potentially distressing subjects. None of this is medical advice. We're just having open conversations about the history, what we've heard from different folks. The risks of untested or non-approved remedies. There's no judgment here. We know that several cultures rely on different types of remedies for different types of ailments. So please don't take anything we say here as medical advice. We're just having these conversations. If you have any medical concerns, please always consult your healthcare provider. And if you do have any concerns about poison, always contact poison control or call your local emergency services. I just want to say that and preface that just so people understand we're not advocating for this either way. We're having a discussion, an open discussion about it. So with that, I will turn it over to Dr. Felix just to give us a brief overview of your background before we dive right in.
All right, thanks for asking me to come back. So I'm in OBGYN. My name's Dr. Sharice Felix, and I've worked for Planned Parenthood of Florida, I guess pre-merger and post-merger now for a couple of years. So I'm happy to be here. Hi.
Thank you, Dr. Felix. And yes, our organizations just went through a merger. For those listening, this is our first season of Birds.Bees.Bodies as a merged organization. There were two affiliates in the state, Planned Parenthood of Southwest Central Florida and Planned Parenthood of Southeast and North Florida, which you were used to hearing this podcast brought to you by. And now we are one bigger and bolder organization, Planned Parenthood of Florida. And Summer, please introduce yourself. Summer's been with us for quite some time as well.
Yeah, thank you, Michelle. My name is Summer. I'm an education program coordinator and community educator. I've been with Planned Parenthood for 7 years.
Amazing. And so I want to start off just talking about any relatable like home remedy stories that either you heard growing up or you even tried at some point for reproductive health care. I have heard everything from using vinegar and garlic for yeast infections. Like I've heard that growing up. I know Dr. Felix's eyes are opening super wide. I've heard, people taking like raspberry red leaf tea to ripen the cervix before labor, and so many different things. So do you have any stories or that you've heard of growing up or from other folks?
Well, yeah, I've seen a lot like over the years. So I've been blessed with a really long career. So through all my phases, I've sort of focused on different aspects of reproductive health care. And I think during my hospital-based years where I was doing a lot of deliveries, there were all sorts of home remedies. There are all sorts of things that people did to ripen their cervix, to get them ready for labor, to make labor happen. As you know, there were teas, sex, orgasm, semen, all sorts of things to get labor going. And then as I moved out of that into GYN care, you start looking into all sorts of home remedies for perimenopausal symptoms and menopausal symptoms. And I am also part of the TikTok culture. So I'm on TikTok. I'm on all social media. And of course, I'm a sexual health advocate. So my feed is pretty broad. And so I see all kinds of things that are coming through that you can buy on TikTok to make your vagina tighter, to make it smell better, to make it feel better. So there's all sorts of sexual remedies that are out. So I went down that rabbit hole and started looking at, like, well, what's in that? Like, how are they making these claims? Why is this so popular? That sort of thing. And they all kind of go back to some herb that people used a long time ago. So like you can buy these, I don't know how graphic I can be here, but like there are these things called pussy pop pills, right? So I'm like, what is in that? As it turns out, it's really like a turmeric concentrate in these oils that, you know, supposedly have anti-inflammatory properties. But it kind of goes back to like what we're seeing on TikTok and what we're seeing on social media are more adaptations to maybe some ancient herbal culture. But the gap between what it was and what it is and how it's being marketed, like
Marketed, yeah.
that's the scary part. Like, do I really need to buy pussy pot pills, or should I go buy some turmeric, or should I do neither one? I don't know, either one.
Right. Well, and there's also like the deceptive practice, right? Like there's some that could be very misleading. There are others that probably have some benefit, but the way that it's marketed, it's not clear of what the benefit
Right,
is.
right. Super like popular are steamings. Like you can go get a
Oh, the
vaginal
Mm-hmm.
veggie
steaming.
steams. I had to ask you about that. Remember a while back
Mm-hmm.
because somebody told me about that, and I was like, all right, I need to ask Dr. Felix, what on earth is a veggie steam?
Yeah, there's that, and then there's what else are people doing now? Oh, the yoni beads or yoni beads. They're
Mhm.
pearls that you put inside the vagina, and they're supposed to just sort of suck in and absorb all of the bad things that are in your vagina. And then like they show these pictures of them taking it out, and they're scary. Like the after part when you take them out, like there's all kinds of junk on
This
there.
goes back to almost like decades ago, the concept of douching and like doctors telling
Mm.
you like the vagina is a self-cleaning organ, you don't need to douche, and like people
Mhm.
still trying to find ways to cleanse your
Cleans it
vagina.
out. Mm-hmm. Mm-hmm. Yeah.
What do you think, Summer? What have you heard as part of remedies?
Yeah, well, I was looking through because I've done a lot of research specifically about like midwifery and natural birth. And in some midwifery curriculum, they actually have classes that are just called like herbs. Now, I haven't taken any of those classes or anything. I was just looking through the curriculum. So that's interesting to me. And it makes me wonder if those are even a part of your typical OBGYN courses to maybe dispel some things, but also talk about how some things actually are accurate based on studies or what have you. Um, One thing, in addition to drinking different teas, I've heard of for like increasing milk production. I've also, this isn't an herb, but just kind of on the same like track of maybe indigenous rituals and natural things. I've heard of actually consuming the placenta post birth, rather encapsulating it in little pills, or some people freeze it right after birth. That's really important. Cut it up and maybe put it in smoothies. And that kind of natural ingesting that after birth, I've heard of can
There's
increase,
companies that
milk
do that for
production.
you. Yeah, I've
Oh,
heard of
companies.
companies that do
Mm.
that for you, that they will encapsulate your placenta for you,
And
and you
there's
have to fill out
actually
all this paperwork.
And there's actually data that supports like as crazy as that sounds, but like it decreases
Mm.
postpartum depression in women.
Yeah.
Wow.
Yeah,
Yeah,
I
and
never tried that.
That's
I never did
amazing. I'm
that,
gonna.
but
yeah, and I've had again, I have to go back to, it's like I feel like I've had a really long career, and it's not as long as most uh people that I look up to, but there, it was kind of new when I was in the hospital. Like it was trending then, right? Where people were, they wanted to take their placentas home or they wanted to ingest it. And I actually started seeing people that would have a prior history of preeclampsia, right? And then they delivered this next pregnancy and would ingest their pregnancy and develop postpartum preeclampsia after they ingested their placenta. So there was some sort of tie between what was going on in the placenta and in ingesting it. So there, on accident, we sort of found out like, or it was sort of proven to me like if you eat this, like it's going to have some sort of effect on, how your body processes your postpartum period. So there's some truth to it, but whether or not if it was well studied and how much of that you should ingest and who's the right candidate for it. Like if you have a history of preeclampsia, maybe you should not, maybe you're not a candidate, but that's the scary part is like what's good for one isn't necessarily good for all, right?
It's not good for all, and it hasn't been tested, right? Like,
Yeah.
on all groups either.
Yeah.
I wanted to talk briefly about like the history of kind of how this came about. And I think there's so much importance in why communities, over time have turned, I guess I shouldn't say turned to botanicals, because maybe that's where we started, right? Before the invention of medicine. That's kind of where we
Right.
started, of, being able to find, certain teas or certain herbs that helped ease menstrual cramps, right? And like a lot of this probably we learned from our grandparents or their grandparents, like, oh yeah, I always took this and like I eased my menstrual cramps or did this. So I wanted to talk about that, like the scarcity of medical care and what kind of impact that had on creating all of these remedies, whether some of them had truth to them or not, or some of them have been, proven debunked, or some are still practiced to this day.
I think that patients are frustrated sometimes with access, like how easy is it to get in there to see somebody? Um, if it takes a long time to get in and you're not actively cramping at the time, sometimes it's hard to get that validation from your provider. Like you don't understand how bad it really is when it happens. So sometimes, just the validation from providers. But I think access to healthcare is kind of what it boils down to. If you don't have easy access or if you have a provider that is continuing to give you the same thing even though it's not producing the outcome that you want, so you don't really feel heard and validated, then sometimes people will just step back and talk to their elders, like, well,
Well, and some cultures have like an instilled distrust of medicine and medical care too.
yeah,
Depending on what your background is. Like as a Hispanic, I see a lot in my culture where, depending on your nationality, like you might have distrust of like going to the doctor because they're like, I've heard it before in my family. Well, they're going to find 300 things wrong with me when I know if I just do this, I can take care of it. And it's like, yeah, maybe in the past, but you might have a chronic issue that needs to be seen, and there's more to what's happening to you or more to your ailment. Um, but yeah, I think overall there's so many different cultures that view medicine differently.
yeah, I think so too, especially if you feel like you've been, not really cared for by the healthcare system and you've come for recurring problems or issues and they're still recurring, they're still happening, then you're really going to look outside of that norm.
Yeah. I
Yeah.
wanted to talk oh, go ahead, Summer.
Just to your point, to both of your points, especially like that kind of passed down knowledge. I think once again, because I did a lot of research about like natural birth and midwifery, but that goes along with these natural remedies that we're talking about in reproductive health care, and how, like natural birth and midwives were kind of trusted to, help people who are pregnant and having babies. And then when the, medical establishment, came around and more about profits and medicine. But I feel like both of those can exist at the same time because it's really, for instance, when I interviewed a midwife for a paper, she said that when a client comes in, they kind of have a checklist. And if they determine that you're just not the right fit for midwifery care, then they do refer you to an OBGYN. So it's understanding that for some folks, like taking these herbs, like you said, Dr. Felix, going the natural route, whether it be birth, like I'm talking about, or for any, some sort of ailment, might be okay for some. And then some, it's great that we have the ability for those interventions when they're needed. Like they can exist at the same time.
Yeah, I agree.
Absolutely. And the practices for midwifery and all of that, postpartum doulas and all that has advanced so much too in so many years. Like like we think medicine has advanced, but so have those natural practices. And as information is shared in the community and for folks who are able to do this kind of work, like they also learn of new techniques and new methods and advance. I think absolutely the two can coexist, and we're seeing that that it is becoming way more popular. People learning how to give birth in more natural ways, or even if you're going into a hospital setting with an OBGYN, and Felix, Dr. Felix, you can talk more about this, but having I guess certain preferences, right? That you'd want to try to keep your labor as natural as possible to a certain extent, right? Without medical intervention.
Yeah. And I'll just say, I learned more about breastfeeding and breastfeeding complications from the hippie lactation nurse that the hospital hired than I ever learned in residency, that I ever learned in medical school. She used to tell people, to drink a dark beer, a half of a dark beer every day, and it would help milk production. They never taught us that in medical school, but there are all these things, all these tricks that everybody else knew that I didn't know. So if it wasn't in my data set, then it was completely rejected by me. But it really took me sitting down and like listening to my patients come back and say, oh my gosh, that worked so well. And I'm like, what worked? Well, your lactation nurse told me to do X, Y, and Z, and now I don't have these problems anymore. But it took me hearing it over and over again, my patients walking back in saying, yeah, that pill you gave me didn't work, but that did.
Yeah. Well, and it may have worked for some who were told, and then not for others, right? That's the other part too, like depending on yeah. I ended up, I remember with my first baby, I ended up buying like all these things to try to help like speed up milk production. And at the end of the day, I don't know if any of them worked. I will say my milk production did get established at a certain point, right? Like I think I tried everything under the sun, the milk cookies and like all these other things and powders and mixes, all proven, right, and safe to like try as a nursing mother. But I will say that one of the things that struck me is one of the ones that I found worked the most. I won't say the name because I don't want to promote or like, do anything with brand on this. I used the powder in my water, but I drank a lot more of it. And I'm like, maybe I was just dehydrated. And like maybe it just dehydrated me. And so now my milk production went up. So sometimes we'll never know, right? Sometimes we'll never know if it really worked, or was there something else you did. But I do want to touch on something that has come up a lot, especially after we've seen, abortion restrictions across our entire country. This has become a topic that even we have a blog about, and Planned Parenthood Federation of America has a blog about as well. And it's talking about folks who have over time used herbs for abortion care. And I want to preface this by saying that that's not something that we're suggesting. In Florida, there is an abortion law that says you can only have an abortion up to 6 weeks of pregnancy in person with a physician, and you have to have 2 appointments minimum in person with a physician in order to access abortion care, and only up to 6 weeks. So I want to preface that by saying that. But this is a discussion that I wanted to have because, there are certain herbs and things that when you are pregnant in an intended pregnancy, right, that your doctors tell you to avoid, or you read about it and you're like, oh, you shouldn't have this because it could have an issue with your pregnancy. And some of them are certain roots that have been, or plants that we have been told over time, like avoid doing that or avoid eating too much of this. Like even when they tell you avoid fish that are high in mercury, right, that it could be harmful to your pregnancy. So there's certain things that doctors will tell you to avoid, or you read about that you're basically learning, okay, I should avoid this because it can cause a miscarriage. And then there's folks who believe those same herbs or plants can also be used to then produce an abortion, right? Even though there's no scientific evidence to show that anything that could potentially cause a miscarriage, if consumed in high amounts, would actually cause an abortion or is a safe way to end a pregnancy. So I wanted to just have a discussion about that and some of the risks involved with that. I also want to preface this by saying there are some cultures that this is a totally acceptable way for them to proceed with ending a pregnancy. So I don't want to come off as this is a judgmental conversation, because it's not. It's really just us sharing information and what we know in our field of work.
Mm-hmm.
So I again, that was not something that was presented in my formal training. And then since I've been here in Florida, the most I've seen, or the most I've had patients actually admit to, is just, finding some sort of bootleg medication off the street, like a pill or something that didn't work. But I haven't had a lot of experience with people, you know, drinking teas or using other natural remedies to produce abortion. But I have seen it again. I'm part of TikTok culture, and it's coming across my feed a lot more frequently. And it's been in some of the shows as well. Like, when I think like Game of Thrones and some other shows like that, they had teas in there that the women would drink to control their fertility, or control if they, had another pregnancy. And I
Or
was
prevent a pregnancy too, I think.
shocked.
Yeah.
Yes, I was so shocked. And it was presented, really well, but I just sort of let people know that abortion's been around for a long time. But my concern with that is, even in controlled situations where we have proven medications and we understand the risks associated with them, and we understand the procedure and a procedural abortion and the things that can go wrong, there's no control when you're starting to talk about using herbal medications and remedies, and when you're doing things on your own. So my main concern again is like, again, how much are these patients going to be bleeding? What's their infection risk? Like, yes, they may partially get rid of the pregnancy, but if they don't take enough and there's only a partial removal of the pregnancy, women can die that way. So it's scary for me to think of people completely managing that process at home, with random herbs that they get from uncontrolled and unverified sources. So that women's
Absolutely.
health, health and safety first, always.
Mhm.
So yes, there's probably data on it. There's probably a natural way to do it. But I don't think that there's any standardized, acceptable way that is proven to be safe. So you're kind of out there on your own, winging it. And pregnancy is a scary thing. When things go wrong, they go really, really wrong. And so you don't want to be on that side of things, on the wrong side of things, without the help that you need and without the answers, right there for you. So I'm nervous about that part.
Absolutely. Summer, any other thoughts you have?
And to add to what you already said, Dr. Felix, in addition to, like you said, if folks take matters in their own hands with herbs or what have you, and it wasn't a complete abortion, the follow-up care is really important too, right? To ensure that, it went through and the person's healthy and, they're okay, whether the follow-up is the ultrasound or just blood work or meeting with the doctor or whatever.
Yeah. And it gets also really tricky when things go wrong. Like, if we have people that, we're here, we're always here, we're here no matter what, care for all. But there's only so much we can do in an outpatient setting as well. And so I worry about people showing up and being, beyond our scope, and then we're having to refer them out, or them needing to go to a hospital and then having to answer those questions in a facility again where things can be really tricky.
Yeah, I
Very
wanted to
tricky.
highlight that too. And again, reiterating that in Florida, it is illegal for you to have an abortion without a physician. But we know that things are happening across our country that are really scary. And we are seeing folks that in different states that are having miscarriages, right? This is not anything that they did to cause an end to pregnancy, but it's, miscarriages are common. And they're having a miscarriage and they are being prosecuted by law enforcement for a miscarriage. Like, these things are happening. So like, there's so much, there's health risks, there's risks that are happening for folks that are just experiencing natural parts of, unfortunately, that are part of pregnancy,
Right.
where you could have a miscarriage. And I want to also highlight too that, we offer miscarriage management at our health centers. Like, if you at any point are having a miscarriage or believe that you were in a pregnancy and you're having excessive bleeding and everything, and you want to see a provider, we can see you and we can help you. I think that's really important to highlight too, that you're not alone in that. I feel like decades ago, and even not, maybe not even decades ago, but years ago, I feel like it was something that was less talked about, miscarriage. And like, if you had a miscarriage, you just kind of went through it quietly at home and suffered in
Right.
silence. Right. And now you don't have to do that. Like, you can go seek help. They can make sure the doctors can see what's going on in your uterus, if it is indeed confirm it is a miscarriage. Because sometimes people, while they're pregnant, may bleed for unknown reasons and everything's fine. So
That's
just
right.
confirming it's a miscarriage, like helping and make sure if you need further medical intervention, or if you don't, all of
Yeah.
that is important.
And that you have options for treatment as well. So if you come in and it's been confirmed that you've got a pregnancy that's no longer progressing, so that's called like a missed miscarriage. So the pregnancy is no longer progressing, but you haven't started bleeding, or you've bled, but you haven't passed the pregnancy. We can give you medication so that you can go home and pass that pregnancy at home if that's your choice. Or, we can help, we could sedate you in office and do an in-clinic abortion as well, and just remove the pregnancy that way. So you've got options. You don't have to necessarily have a procedure if you've had a miscarriage. And if you want nothing done, if you just want your body to take care of it, then, we can just provide the oversight and check in with you, just to make sure that you stay safe through the process as well. So you can
Yeah,
come in for that.
absolutely. I think that was important to talk about. I want to get back to other common home remedies, and some myths for inducing labor, because there's one that is kind of funny, but also has some, I guess, some truth to it, because it's so widespread in the community. You're gonna know exactly what I'm talking about when I say it. So I was a part of all these pregnancy apps when I was pregnant with my sons, because I always wanted to hear what other pregnant women were going through and compare. And like, am I doing that too? Is that something I'm feeling too? And when it got time, it always happens, if you've ever been part of a pregnancy app, when you get close to the end of your pregnancy, when you're reaching full term and you're getting close to your due date, everyone is desperate to get this baby out, like everybody. So, right, everybody's talking about, like, what can I do to induce labor? I'm gonna go curb walking, I'm gonna walk 3 miles a day, I'm gonna have sex, I'm gonna do all these things, because they're thinking, what can I do to get my cervix ripe to induce labor? I heard some folks, or read some folks on the app talk about castor oil. And I want to bring that up because it is something. Look, I see your faces, and this is something that I learned too, that in controlled environments, like, some midwives have used this as well, and it has worked. That's what I read on
It
Surf.
works.
And hold on, but I also read nightmare stories of women
Yes.
taking castor oil,
Mhm.
and they
Everything comes out.
and everything came out.
Everything comes out.
Like,
When I had women on castor oil laboring, I just put a shower chair in the shower.
oh,
Fine. You
Real
did
talk.
this. Sit in the shower. When the baby's coming out, then I'll come in. Because
because they were
everything comes
just
out.
pooping themselves everywhere. Like,
Yes.
you can't control it. Like,
You
it's just
cannot control
cleaning
it.
out your system.
Everything is coming out.
That's
Yes.
that's
Yes.
horrifying, terrifying.
Absolutely.
I guess it worked for them though. They went into labor.
Every one of my patients that did that.
Oh gosh. But
I'd
this was
actually said, "No."
something you never recommended to them. Like, this was something they did on their own. Okay.
Right, right. And because in residency, like,
Mhm.
we didn't recommend that. It was actually, no, don't do that. And there's not good data on it and blah, blah, blah. Again, like, and to be fair, there's not a lot of companies that are gonna fund research in the efficacy of castor oil. There's no money
Mhm.
to be made there, right? So
Yeah.
we're going to rely on old data that's probably unreliable, but it's going to come
Mhm.
back just as, like, it's going to come back just like in the stories that I'm telling. Like, I have no data to support that yet. 99% of my patients that took castor oil, like, we were in it, like boots and gloves, and
Goggles,
they,
like the the eye
yeah, I
protection.
couldn't have had all this for sure. I could not have, would not have had
Oh my
it.
goodness.
Yeah, that
Wow.
absolutely works for sure.
Well, we laugh about it, but I will say that I also read from folks on the same pregnancy app that said, "Oh yeah, I tried that several years ago with my midwife. It was very controlled. The amount, like, they gave me a specific amount. They told me exactly what to do, and it put them into labor without all of the other side effects that." So I don't want to judge folks
Hilarious.
who've done that. I don't want to, knock it, right? Because I know that it
Right.
is something that people use. But yeah, it was definitely not something I was considering, not one bit. When I was like, you know what? He'll come out when he's ready. I'll try the raspberry leaf tea. That seems harmless enough. Do some curb
Right.
walk, stay active. I had at my desk, I had one of those bouncing balls too, like all these things. But yeah, it's super, super interesting stuff. And I'm always interested in hearing about, how folks over time have they swear by things. Oh yeah, this works. Like I've taken this works. So we're always interested in hearing about it, but always with caution and knowing that you need to always keep in mind if you're using things that are not FDA approved, there's always risk for poisoning, toxicity. If you're allergic to something, I mean, you can be allergic to medication that even is FDA approved. Like everybody's body responds differently. So, any other final thoughts that you all have on this? Because it's such a good conversation
On the boric acid or anything?
on any of the home remedy stuff. Yeah.
Well, I think I'm kind of concerned most recently, again, being part of TikTok culture, is how easy it is to obtain treatments for BV now. Like you can get boric acid suppositories, and not that they're not FDA approved, like that's sort of the gray area. So you've got an FDA approved medication for an indication of vaginitis or vaginal infection. And then people are grabbing those and self-treating, not really understanding what they're treating, um, or really what that medication is, because now they're starting to repackage it and make it look cute and pretty, and you can get, you can order it from the nicely market, like the tightly marketed companies, the healthcare companies that you never really talk to any provider. It's a
Yeah.
text through the app, right? But you can get these treatments now, boric acid suppositories, and they help for a little while, or you've got somebody on chronic boric acid suppositories because they're chronically having symptoms or issues, and like the light bulb doesn't go off, like maybe I'm not treating the right thing, or maybe this isn't the right treatment for the symptoms I'm having, or patients are assuming that they've got just run-of-the-mill pH imbalance, but maybe it's not. Maybe it's one of those atypical bacterial vaginitis strains that their partner actually needs to be treated for as well. So, like ureaplasma and mycoplasma, those things you can't treat with boric acid. It's not going to work. So the people that have chronic infections, those are the ones most likely to reach out and start getting chronic treatment from a site. So there's that little gap in healthcare. There's the demand there, and now it's easier to get, but the medical part is missing in between. Just
Yeah.
like a patient that has symptoms, and then something that's packaged up really nicely on TikTok and easy to get at 3 a.m. while you're trying to figure out like what your next day is going to be like. It's super easy to make those impulse buys and then just delay treatment and delay actual diagnosis. So that's one of my concerns, just as a
Yeah, well said, Dr. Felix. I 100% think that's something to lift up. And as always, like if you experience any symptoms that are bothering you or things that are unusual for your body, it just makes sense to like book an appointment with a healthcare provider and get to the root of what is the issue.
Yeah.
Because I hear you. Like you're on TikTok and you're seeing or you do the Google thing and you search, right? Like I have these symptoms, and then stuff comes up, and you're like, oh, I can try that without going to the doctor. But at the end of the day, you really aren't going to know what you have unless you see a healthcare professional and can diagnose what the issue is. So,
Yeah.
100%. And if you all want to learn a little bit more about our services and how we can help with those problem visits, whether it's, an infection, burning, itching, like dryness during sex, all those things can lead to different problems that you might have. Not to say you have more than one problem, but I'm just saying like the doctors can help and the providers can help diagnose exactly and figure out what the issue is. We can see you for all of those reproductive health care concerns. We can see you for fertility testing and treatment if you're curious about that. We have prenatal care up to 14 weeks. We can help you with postpartum care. As always, if you're experiencing uncomfortable menstrual cycles, heavy periods, lots of cramping, like we can always work with you as well. Our providers are equipped to be able to give you some solutions to help ease you through this and provide care. So learn more at ppfl.org. As Dr. Felix mentioned, we're here for you no matter what. There is nothing you can bring to this team of doctors and providers across our state that they haven't already seen or heard. I mean, I'm sure you've been tested sometimes, Felix, and learn new things every day. But there's no shame, there's no judgment. It's just care. So come see us and follow us on social media. Our handles are PP Florida. Follow us. We're all over social media. We have a Spanish account as well, PP Florida _ES. So check us out. Thank you both so much, Summer and Dr. Felix, for being a part of this podcast. I think it's such a good topic and something that people talk about all the time, and maybe a little taboo too. Like not enough people are talking about, this and how important it is to just like discuss it and share what's worked, what hasn't worked, where are the concerns. So I hope we did that for everybody today. All
Thank you,
right.
Michelle. Thank you, Dr. Felix.
Thank you, guys.